Well, nearly every day in our newscasts, we report violent crimes. According to the FBI, violent crimes are defined as a homicide, rape, robbery, or aggravated assault. But what does the aftermath of those crimes look like?
WRBL's Hannah James spoke with our frontline workers who come to the aid of the victims and families of these violent crimes repeatedly. She joins us live now. Hannah.
Teresa, Phil, I spoke with one registered nurse who says she sees more than 100 patients go through Piedmont Columbus Regional's emergency room. Now, while not all of those are victim of violent crimes, she says she has seen an increase of those in the last year and a half that she's worked here. She gives us an inside look to the emergency room that's behind me.
I've seen more drug abuse recently, a lot more shootings going on, more than what we would like.
In 2022, the Columbus Police Department investigated 640 violent crimes, according to their annual report. The police department says most of those victims are sent to Piedmont Columbus Regional.
It can be nerve-wracking, but when you have the patient laying there and they're fighting for their life, all of that goes out the window and you're solely focused on a patient's life. And none of that matters. It's like another day-to-day patient.
The Muskogee County Coroner's Office says some homicide victims are pronounced dead by emergency room physicians.
Sometimes it's very emotional. Sometimes it's hard to take care of. Sometimes patients humble me. And that's all that's in the process of working as a nurse. You have happy days, sad days, all the above days.
In addition to Columbus victims, Piedmont Columbus Regional services patients from areas in both Georgia and Alabama. Stone shares what helps her mitigate the traumas she comes face to face with every day.
Having a strong support system is probably the best thing that we could have at this hospital, especially in our ER, because we endure so many traumas, so many emotional roller coasters, and to have that support system here is our #1 goal, and that's what we have.
Stone says they have constant debriefings and an open door policy for all workers who need help or someone to talk to. In addition, Piedmont Columbus Regional has several behavioral health resources available to all faculty and staff, and an on-site chaplain for support as well.
Phil, Teresa, Stone says she loves her job despite all of the violence that she comes to face with every day. Now, coming up on News 3 at 5:30, I also spoke with the Director of Emergency Services here at Piedmont Columbus Regional to learn more about that increase of violence and victims here in the ER. But for right now, I'm going to send it back into you. Reporting live from Piedmont Columbus Regional, Hannah James, WRBL News 3, on your side.
Thank you so much, Hannah. Today's special will also continue on News 3 at 6 when we'll hear from the chaplain at Piedmont Columbus Regional about the spiritual support that they provide.